Here we are with chapter 15, talking about water supply hazards and public health. Providing clean water is one of the most fundamental public health services, but maintaining safe drinking water requires constant vigilance. Emergencies, whether from floods or earthquakes, power outages, or chemical events, can quickly threaten water safety. That's why strong pre-existing community partnerships are essential, especially when communicating boiling water advisories or ensuring access to bottled water. In this case, the Portland Water Bureau supplies drinking water to about 1/4 of Oregon's population. The source is surface water from the Bull Run watershed in the Mount Hood National Forest, and notably is unfiltered. To treat the raw water, chlorine is added first, then aqueous ammonia introduced to form chloramine, and pH is adjusted. Under long-term to enhance surface water treatment rule, unfiltered systems like Portland's must specifically address cryptosporidium risk with at least 2 disinfectants. Cryptosporidium is a protozoan parasite found in surface waters worldwide. In the environment, it exists as a thick-walled oocyst that is highly resistant and can survive harsh conditions, including standard chlorine disinfection. When ingested, it can cause gastrointestinal illness that may be severe, especially in immunocompromised individuals. Contamination of drinking water typically occurs when fecal sources such as infected humans, domestic or wild animals, um, with wastewater discharges. Because cryptosporidium was detected in raw water and concerns emerged about response capacity, a multi-agency tabletop exercise was developed in 2018. The goal was to identify gaps in detection, investigation, and response to a potential drinking water contamination event. The exercise led to a formal gap analysis, revised procedures, and strengthened preparedness for future water emergencies. So after someone ingests cryptosporidium, symptoms typically start about a week later, though that can range from 2 to 12 days. The most common symptoms are watery diarrhea, abdominal cramps, nausea, vomiting, and sometimes weight loss. For healthy individuals, the illness is usually self-limited, but for people who are immunocompromised, it can be prolonged and severe. Transmission is a key concern. People can become asymptomatic and still spread the parasite. Even after symptoms resolve, individuals may shed it in their stool for 2 weeks or longer. Spread occurs when fecal contamination, either direct contact with infected people or animals, or through contaminated food or water. Importantly, most human cases are caused by just 2 species, C. parvum and C. hominis. While other species have occasionally been identified, these two account for the vast majority of infections and outbreaks. Cryptosporidium is particularly well suited for transmission because it has very low infectious dose and can survive standard chlorine disinfection. That makes it especially dangerous in chlorinated drinking water systems. A striking example is from 1993 in Milwaukee when an outbreak, the largest documented waterborne disease outbreak in the U.S. history, occurred. An estimated 370,000 to 435,000 people became ill, and approximately 69 deaths were associated with the event. In response, the EPA implemented significant regulatory changes to strengthen protection of surface water systems. These changes focused on improving monitoring requirements and enhancing treatment, particularly filtration, to better remove cryptosporidium from drinking water supplies. The Bull Run watershed is the primary drinking water source for Portland and serves nearly a quarter of Oregon's population. It provides water to about 342,000 customers through wholesale providers. Located 26 miles from downtown Portland in the Mount Hood National Forest, it is a surface water system with groundwater from the Columbia South Shore well field used as emergency backup for summer demand. The watershed spans 102 square miles of heavily forested land and receives substantial rainfall every year. Two reservoirs store over 17 billion gallons of water. Raw water is disinfected with chlorine, then treated with chloramine and pH adjusted at the Lusted Hill facility. Key protection strategy is limiting human activity. Since the 1977 Act of Congress, the area has been closed to public entry. Federal, state, and local control strictly limit access, and no recreational, residential, or commercial activities are allowed, helping preserve water quality at the source. Multiple authorities monitor the Bull Run water source. The Portland Water Bureau continuously tracks water quality and quantity to ensure compliance with state and federal standards, guide operational decisions, and monitor long-term trends. The Oregon Health Authority's drinking water services also conducts regular inspections of the watershed and treatment facilities. Bull Run meets the 1989 Surface Water Treatment Rule filtration avoidance criteria. Filtration is one method used to remove pathogens from drinking water. Under the Surface Water Treatment Rule, all surface water systems must filter unless they meet strict water quality and watershed protection standards. Compliance is demonstrated through monitoring turbidity and fecal coliform bacteria. Turbidity cannot exceed 5 NTUs, and fecal coliform levels must remain below regulatory thresholds, no more than 5% of samples exceeding 20 colonies per 100 milliliters over a 6-month period. A disinfection reduces infectious pathogens in drinking water. Under the long-term 2 enhanced surface water treatment rule, unfiltered systems must treat for cryptosporidium and use at least 2 disinfectants. The Safe Drinking Water Act allows a variance if a system can prove it protects public health. Portland Water Bureau received that variance due to strong watershed protection and monitoring. However, after low-level cryptosporidium detections in 2017, the Oregon Health Authority revoked the variance. A compliance agreement now requires treatment by September 30th, 2027. Up until then, PWB monitors twice weekly, increases sampling if detections occur, issues public notices, conducts enhanced reporting and watershed inspections, and performs outreach to vulnerable populations. Cryptosporidium poses the greatest risk to children and people with weakened immune systems, including individuals with cancer, HIV/AIDS, and transplant patients on immunosuppressive medications. In these groups, illness can be more severe and prolonged, often causing chronic diarrhea that can lead to dangerous fluid loss. Severity depends on the level of immune suppression. Following detections in the water system, MCPH and the Portland Water Bureau began annual outreach to healthcare providers caring for immunocompromised patients. This messaging includes guidance on diagnosis, testing, and clinical management, along with brochures and posters for clinic settings. And here's an example of the Portland Water Bureau's educational brochure about cryptosporidium in drinking water for immunocompromised individuals. Cryptosporidiosis is a notifiable disease in Oregon, meaning that labs and providers must report confirmed or suspected cases to the local public health authority. Every reported patient is interviewed to identify exposures like drinking water source, recreational water, animal contact, child care settings, or certain food exposures to provide prevention education. All information is entered into Oregon's statewide surveillance system, Orpheus, which allows epidemiologists to monitor trends and detect clusters. If indeed an outbreak is suspected, active surveillance begins. That means proactively reaching out to providers and the public to find additional cases. This is critical because passive surveillance can often miss the true scope of waterborne outbreaks, as seen in Baker City, where only 5 lab-confirmed cases were reported, but active community surveys suggested nearly 2,800 illnesses. One important early detection tool in public health is called syndromic surveillance. In Oregon, this is done through the Essence system, which provides near real-time data from emergency departments and from urgent care centers. This helps monitor trends and symptoms like increases in gastrointestinal illness that could help signal an outbreak. However, detecting low-level contamination from organisms like Cryptosporidium is challenging because symptoms such as abdominal pain and diarrhea are non-specific. Many people don't seek care unless illness becomes severe enough, which limits early signal detection. That being said, syndromic surveillance provides critical situational awareness and can detect a dramatic spike in emergency visits if a large community-wide outbreak occurs. From an informatics perspective, timely and complete communicable disease data are essential. Strong data governance allows state and local health departments to conduct both routine and rapid analyses and to integrate non-traditional data sources during emergencies. Public health officials routinely analyze surveillance data to look for trends by age, sex, race, geography, and other risk factors. For cryptosporidiosis, these risk factors might include international travel, recreational water exposure, or contact with infected animals. There's also a 24/7 reporting system, so providers or the public can quickly alert health departments to unusual increases in illness. The goal is early detection and rapid intervention to prevent spread. Laboratory data are the backbone of surveillance. Most cases are identified through clinical specimens tested by labs using microscopy, antigen detection, or PCR. Labs can also speciate cryptosporidium, which helps identify likely sources of infection. Whole genome sequencing is an emerging tool in outbreak investigations as well. While more commonly used for pathogens like Salmonella Listeria, networks like CDC's CryptoNet are building genetic databases for Cryptosporidium. Although typing methods for parasites are still evolving, genetic tools can help link human and animal infections and strengthen outbreak investigations. Effective crisis and risk communication is critical during a drinking water emergency. Messages must be clear, consistent, specific, and transparent. Preparation matters as well. Developing talking points and educational materials ahead of time allows for rapid response. Building relationships with hospitals, community-based organizations, elected officials, utilities, and local businesses is also essential, especially since facilities like dialysis centers, restaurants, healthcare sites, they all rely on heavily on water and may need tailored, culturally appropriate messaging. Tools like CDC's Drinking Water Advisory Toolkit should always be customized to fit local context. Before an incident occurs, routine risk communication is already in place. For example, Portland provides quarterly notifications informing the public that Bull Run water is not currently filtered for cryptosporidium. Outlines they outline potential risks, and they also explain future filtration plans. These notifications are required under the bilateral compliance agreement and may be delivered through press releases or annual reports. And this here is a visual explaining the Center for Disease Control, CDC's Drinking Water Advisory Toolkit. It shows what's supposed to be done before an incident, during an incident, and after an incident. The Portland Water Bureau does not currently treat for cryptosporidium, but is required to install filtration by 2027 under an agreement with the Oregon Health Authority. In the meantime, interim measures, including watershed protection and enhanced monitoring, are in place to protect public health. Cryptosporidium can cause gastrointestinal illness, particularly severe in those with weakened immune systems. Immunocompromised individuals are advised to consult their healthcare provider about the safety of drinking tap water. PWB must notify the public within 1 business day of confirmed detections and clarify whether a boil water notice is necessary. Communication may include press releases, provider alerts, email notifications, and social media posts. Transparent communication builds trust and ensures rapid information sharing. Culturally appropriate messaging is also essential. Public health agencies must partner with community leaders, provide translated materials, and tailor outreach to ensure all populations understand risks and recommended actions. Keeping our drinking water safe requires constant vigilance against contamination and supply threats. The Safe Drinking Water Act ensures that all public water systems follow standards set by the Environmental Protection Agency. The Consumer Confidence Report Rule further supports transparency by requiring water systems to provide clear information so consumers can understand potential risk and make informed decisions. Systems serving large non-English speaking populations must also provide information in appropriate languages. Protecting drinking water is a shared responsibility. The EPA oversees federal standards, state programs monitor and inspect water systems, local environmental health agencies support the smaller systems. Public health authorities collaborate to reduce waterborne disease, and the CDC provides technical expertise, specialized laboratory support during emergencies as well. In this diagram, we see an overview of public water system infrastructure with public water systems at the top. Those are subject to EPA regulations, and below that we have non-community and community level systems. Then there's a breakdown of what those non-community systems are, including transient, which would be like parks, resorts, restaurants, and then non-transient, which would be schools, factories, office buildings, hospitals that have their own water systems. Now, after Portland received a variance in 2012 to delay filtration for cryptosporidium, agencies like PWB, OHA, and MCHD met regularly to share environmental and public health data. When detections occurred, they developed a multi-agency tabletop exercise around 2018 in order to test their preparedness and identify gaps in detection and response. The exercise included surveillance capability assessment, partner workshops, and a formal scenario focused on cryptosporidium contamination. The goal was to clarify roles, strengthen partnerships, and improve existing systems. Participants included regulators, epidemiologists, water system professionals, emergency managers, partners like EPA, CDC, and Oregon Poison Control Center. They walked through two scenarios, which first one included a rise in reported cases through public health surveillance and concerning test result from Bull Run source water. So there were three main objectives of the tabletop exercise. The first was to evaluate whether the existing investigative procedures truly reflected what would need to happen during a real cryptosporidium and contamination event. That meant identifying data gaps, assessing whether the right information sources were included, and determining whether new or novel data streams might be needed. The second was to test response decision making. Participants discussed what would trigger a switch to the groundwater source, when a boil water notice should be issued, and what considerations come into play during an extended notice, especially one lasting longer than 24 hours or even a week. They also assessed public health capacity for case investigation, laboratory testing, and environmental control measures. The third objective, the exercise focused on incident command and communication. Agencies clarified who would be part of the unified command under ICS. They mapped out notification pathways and documented communication strategies for stakeholders, including vulnerable populations who may have special water needs. The output was a comprehensive written report and a set of response diagrams. These tools mapped the agency roles, decision points, and communication flows while documenting leadership, governance, and incident management processes. Overall, the exercise strengthened collaboration and multi-agency decision making before a real emergency would occur. The key lessons from Portland's drinking water case study center on using every available public health tool proactively, not reactively. First, understanding and applying the regulations that protect drinking water is foundational. Public health protection begins with knowing the legal framework and compliance requirements. Second, timely access to complete communicable disease data is critical. Early detection and tracking of waterborne outbreaks depends on strong surveillance systems and rapid data analysis. Third, crisis and risk communication must be specific, consistent, clear, and transparent throughout an emergency. Trust is built through accurate and timely messaging. And finally, every water-related emergency is a learning opportunity. Continuous evaluation and policy updates ensure that systems improve over time and public health protection strengthens with each event.